to VoteProPot-Cast, the award-winning cannabis news podcast brought to you by VoteProPot.com. Here are your hosts, Phil Adams, Jay Britton, and Andrew McCreadys.
Can cannabis cause heart problems? Faye Mitchell joins us today with her insights. A synthetic cannabinoid drug for COVID-19 gets FDA approval for phase 1 clinical trials. How about that? And a new poll shows a majority of Republicans now support cannabis legalization. So that's a positive step.
You got that going for it.
We're gonna get to that and lots of other stuff. Welcome everybody to VoteProPot-Cast. We are ready to rock and roll. But I want to get to this first episode now that I want to adjust my framing here a little bit. You should introduce our
special guest.
Well, you all know. I already mentioned Faye Mitchell, our chief health and wellness correspondent for VoteProPot-Cast.
How's it going, guys?
Hey, Faye.
Who actually starts school
on Monday.
And we told you what she's studying. Faye, tell them what you're studying.
I am studying medical, cannabis, and science and therapeutics. University of Maryland, Baltimore. It's through their School of Pharmacy. It starts next week. It's an online program, so I kind of go at my own pace.
Right.
But I'm really excited, and I also have some extra trainings. One of the training I have to do is a prescription drug abuse prevention. That's just like an extra training. So I'm really cool because it's legit. It's through the pharmacy school. And, that's kind of what we need to bring cannabis into the medical
And this is a
world.
master's program, right?
A master's degree.
And it is the
I will not be a doctor.
No, it is the first program of its kind in the nation.
It is.
And
yes, it is.
It's right here in Maryland.
Right in Maryland.
And
I'm an alum. I went to University of Maryland undergrad. So I'm already a terp who's learning about terpenes.
Good terps. What a perfect mascot.
Exactly.
The terps. All right.
Little I know.
Well, we're gonna get you to tell us all about cannabis and the heart. But first, I want to get to this news story out of Washington. A federal appeals court has denied a motion from the Drug Enforcement Administration, the venerable DEA, to dismiss a lawsuit challenging Schedule 1 classification. We reported back in May, I believe it was, Scottsdale Research Institute filed a suit in the Ninth Circuit Court of Appeals, which is usually more liberal court among the courts of appeals. The suit contends that the DEA Schedule 1 status of marijuana is hindering their clinical research, which is the very research that the DEA requires in order to consider removing cannabis from Schedule 1. So you can't win with these assholes.
You really can't.
Well, the DEA's attempt to quash the lawsuit, the long story short, was turned down by the court earlier this week. So they are going to, the Scottsdale Research Institute is going to get their review of these Schedule 1 determinations, and the DEA is going to have to defend them. So,
well, they've been trying to get permission to do research on cannabis for years.
Oh, since the 70s.
And I think they were.
Yeah.
And there was a doctor recently, like when we first started the show. Remember, we were doing a story about how, she thought she had the green light, and then they put the
kibosh on it.
Kibosh on it in the last minute, and then she went to sue him. And I think that's what this case.
Do you say
has
kibosh or kibosh?
I say kibosh.
I say kibosh. What do you say, Faye?
Kibosh.
Kibosh?
Thank
Okay.
I say kibosh. Yeah.
I've heard it both ways.
Well, you're wrong, Phil.
I guess I'm odd man out here, obviously.
Put the kibosh on Phil.
Right.
Well,
you're outvoted, but you're a Republican. That doesn't matter.
But you do know that they have some patents for some sort of cannabis derivatives, that they want to use.
In synthetics, yeah.
Yeah, and synthetics.
Synthetics, that's what I mean. Synthetics,
Right.
That they say don't have the same side effects, yada, yada,
Bullshit.
yada.
But that's what we do.
Exactly.
It's the same compound. It's just created in a freaking test tube instead of in a plant.
I'm wearing my cannabis shirt today.
There you go.
Same chemical compound. Hello. So,
Yeah.
So what do you think is going to happen with this, Phil?
Well, I guess that's going to be up to the Ninth Circuit. Now, there is another lawsuit against the DEA that they've gone through the appeals courts, and they want to go right to the Supreme Court with it. Now, what this is a coalition of medical marijuana patients and advocates are asking the Supreme Court of the United States to hear their case, just flat out challenging the constitutionality of the prohibition of cannabis on a federal level.
Story, yeah.
Now, so now this, but the problem with this is that this comes after a series of lower court rulings fell short.
Right.
What happened in a U.S. district? Well, the same thing happened in a U.S. District Court and the Second Circuit Court of Appeals. They both directed the plaintiffs, the coalition in this case, first to seek what they call administrative relief through existing channels, such as petitioning the DEA directly, whatever that's supposed to mean, to reclassify cannabis as Schedule II, which is bullshit, because Schedule II, as we've talked about, all that does is, reclassification only limits access to patients and could put thousands of legitimate cannabis companies out of business. And so that's not a solution. And this was the problem that NORML had when Joe Biden came out with reclassification. They said it's not good enough. In fact, in many cases, it's worse. But the Supreme Court has yet to decide whether they're going to hear that case at all. So we're going to have to wait and see. But as for this earlier lawsuit about the scheduling, I think if they have to force or defend this position against Scottsdale Research Institute, who is using cannabis to treat a medical condition,
yeah, you're right.
that flies right in the face of the very definition of Schedule I, wouldn't you think?
Well, yeah, because Schedule I, one of the things in Schedule I is that it has no medicinal value.
No medicinal.
That's kind of late for that, isn't it? I mean,
we're way beyond.
We got 30-some states now using.
Well, reason, practical thinking and reason has nothing to do with
government. That's
here.
for sure.
No.
Critical thinking has nothing to do with what's going on.
Yeah, you got a point there, Andrew.
Yeah.
So what's next? All right. So Jay, did you have
you guys heard of a company called Dutchie? I'd never heard of it.
Oh, is it the company that does the online ordering for cannabis?
I thought Faye worked in a
Dutchie or Dutchie? I thought
it might be Dutchie. There we go again,
Dutchie.
I don't know, but yeah.
You're probably right. It's Dutchie.
Yeah, I want to pass the Dutchie on the left-hand side.
Well, Faye worked in a dispensary.
One of the dispensaries uses them, but I can't remember who.
It's huge, okay? And they just raised another $35 million. And they have CEO Howard Schultz. Remember him from
Starbucks.
Yep.
He's a Starbucks
NBA
guy.
superstar Kevin Durant and Snoop Dogg are all major investors.
I've heard of those guys.
Yeah, and I read this today in Mary Jane. Since launching in 2017, Dutchie has steadily morphed into a cannabis e-commerce monster. Currently, Dutchie services 25% of all legal dispensaries in North America, and even more mind-boggling, 10% of all legal weed sales worldwide go through Dutchie. The company reports 700% sales surge since the coronavirus pandemic took hold. So think about it. They talk about right place at the right time. When this pandemic thing came in and everybody's got to do curbside, everybody's going online to order. Well, these guys were just in the right place at the right time.
I guess so.
Wow.
They lead
That's interesting.
Forecasters
Legal weed
right now.
sales worldwide. That's a tongue twister.
Right. Thank you.
Legal weed sales worldwide.
Legal weed sales worldwide.
Well, here's the interesting thing about that is that there's so many of those platforms, and different dispensaries use different platforms, and you never know which Weed Maps, Leafly. There's Sticky Guide. There's all kinds of them, but you don't know which one to go to.
Apparently, Dutchie is really kind of taking hold. As I said, 25% of all dispensaries are using it now.
Maybe they'll buy up the others.
It's growing quickly. The company reports 700% sales surge, like I said, and they're processing. They forecast to process $2.4 billion in sales this year.
Woo!
Wow.
But wait a minute. They process that. They don't touch a penny of it, though.
That's right, and they're getting a percentage. Are
they getting a percentage?
Nice, that's a pretty nice business plan. You never have to touch any inventory. All you do is take a percentage of the sale.
So when you order through Weed Maps or Dutchie, the percentage of the money,
I assume, it doesn't
the dispensary
Unless
collects,
it's a
they kick back to them. Is it like a Grubhub kind of deal?
Yeah, I don't really know.
It could be a subscription service.
So, Faye, like the dispensaries would have a subscription to it?
Yeah, that's what I'm wondering. Either
The dispensaries are covering the cost of this, probably.
I would guess, but it doesn't say.
One or the other. I know that, like, and they're always like debating which one's bringing them more. Some of them have more than one. Like we had Weed Maps and Leafly, and they were always analyzing the metric. Who's bringing in more business and that kind of thing. So,
well, they just celebrated.
Wait, guys. Isn't Dutchie the word like that's past the Dutchie? Isn't that like a word for doob or joint? There's a song.
Might be.
Yeah, it's a song.
I think it is.
I think it was New Edition.
Past the Dutchie on the left-hand side.
Right. We're showing our age because I didn't know that.
Didn't Phil just sing that?
Yeah.
I can't sing. Phil will have to sing
I think it was New Edition was the name of the group.
Something like that. I'm going to have to look that one up.
They were a British group of
like ska reggae,
really young guys, and it was Pasta Dutchie on the left-hand side.
Like a boy band kind of thing? Okay.
Yep.
Kind of almost a reggae
Do I win the prize?
You win the prize. Well, the Dutchie just celebrated their 10 millionth order. Dutchie CEO Russ Lipson comes from an e-commerce
Okay, are we calling it Dutchie or Dutchie?
Dutchie.
Pick
I don't
one.
know. Which is it? I have no idea.
It's past the Dutchie on the left-hand
All right,
side.
so it's Dutchie. So now I'm like an idiot. That's what I said originally. You guys corrected me. Jesus.
I don't know. I'm just asking.
So the guy who created this, Ross Lipson, comes from an e-commerce background. In 2008, he created Grub Canada, one of the country's first online food ordering services. Yep, the Canada version. He said the idea for Dutchie struck him while he was waiting in line at a dispensary. So I guess my question maybe to you guys is, what's going to happen to Dutchie when the coronavirus is gone? Are people still going to go online and order, do you think, or will they just go to the dispensary?
Well, you could before. You could go online and pre-order.
Yeah. But their sales are up like 700%.
I know, but the problem with the dispensary industry, with dispensaries right now, is that their hands are tied and they cannot. It's very difficult for them to offer good service because there's no opportunity. If you place your order before you even step foot, on their property, how are they going to help you? Right. Give you better service
because of the curbside. You're saying.
Right.
Yeah.
Right.
There's no opportunity for them to go, well, do you have any questions?
Yeah. Right.
There isn't.
Yeah, but I think it's still going to stay because I think there is a very good, there are still a lot of people who are not going into stores, who are going nowhere, who are having their groceries delivered. And again, if we go back to the fact that a lot of cannabis patients are over 60 years old.
Right. It might be taking it for medical reasons, so they...
I've had cannabis delivered to my house. It's been great.
Yeah.
Right. I think a lot of people, I think the future, when all the smoke clears, I think a lot of people, given the option, they're going to go just deliver it like a pizza.
Hell yeah. It's just so easy and convenient. Well, one of the questions as a business guy I ask is, I don't see how this is kind of proprietary, the idea, the business. So why is Dutchie doing so well and not Weed Maps? Why can't someone come copy this business idea?
Well, I think it's probably a question of satisfying customer experience
and market share. Just
it's all about providing. I mean, it's a service industry. If you provide superior service, people are going to use you more, and they're going to eschew the other ones, and you're going to get larger market share. That's just how the service industry works. Choice.
But then now there's some dispensaries that are saying, don't order on our website. Go to Weed Maps.
Is that right?
Mm-hmm.
Right.
Yeah.
Right. And this is part of the beauty of capitalism is that, we offer you the service and the products that you need on your terms because you demand it and you're paying for it. It's not us telling you what you want. It's you telling us what you want. And it works great. And I imagine that even the dispensaries, if they have an online presence, could probably do a lot of consulting via chat and other ways. You don't have to step into the store. I mean, a good business model, a smart person, isn't that right, Faye? Couldn't you do that?
Yeah, that would be a great idea. But right now, quite honestly, at least here, and I'm basing it what I know in Maryland, is that they really can't wait to become retail stores. Right. And I don't know how that's going to translate between people coming in and coming out, but I think they're looking 2 years down the road, 3 years down the road, and they're looking to become, big retail stores. I'm always wondering if there's some that will set themselves apart with this customer service. Hey, we do offer this. We offer people to speak with you, to pick up the phone, to talk. And maybe that will be another way that certain dispensaries set themselves apart.
Well, when the recreational market opens up and more dispensaries open up, it's going to go from a seller's market to a buyer's market.
Yeah.
And in some ways, the buyers they have some clout. A lot of dispensaries are kind of battling over prices here and there.
Well, back to the question.
But they do whatever they want, the dispensaries.
Back to the question about why they're doing so much better than the others. I mean, have they been around longer? Because I'm finding that a lot of companies that started way back when California was first getting started, and they went from California to Colorado, et cetera, they're the companies that may have have been in it for the longer.
They've only been around since 2017, and I think Weed Maps has been around a lot longer than that. So
whatever they're doing,
they're doing it right.
I mean, it's sometimes the second. They always say the early bird gets the worm, but the second mouse gets the cheese.
That's right.
In
business.
But you see a business model that's doing okay, but you could do it better.
Well, I went on their website.
And you come along and you do it better.
They've got a nice website. It's very well constructed. It's very easy to navigate, and of course, that's everything when it comes to online ordering. It's all about the interface, right?
So. Now, Andrew, you mentioned something about. Me being a Republican, and technically speaking, I'm not a Republican. I am a conservative, but I was just joking, Phil. But if I were a Republican, I would be among a group of people whose minds are being changed.
Well, actually, it's interesting you should say that, because a new poll just came out, and where it says the majority of Republicans are now in favor of legalization. Now, the majority of them have been in favor of medical for quite some time.
You're welcome.
It's all about VoteProPot.
Are you the majority?
No, Phil is the one Republican speaking out for legalization. Right. Supposedly, yeah. But interestingly, Donald Trump just made an announcement telling a lot of the Republicans to shy away from putting cannabis on the ballot, especially any kind of ballot initiative or any kind of vote on legalization, because he believes if cannabis is on the ballot, more Democrats are going to show up to vote for that. And while they're there, they're not going to vote for him.
They're going to vote Democratic. Right. He's probably right.
Yeah, I think it makes sense.
But we just heard that over half of the Republicans are in favor of it.
Yeah.
So a lot of Republicans are going to show up who were for.
Maybe he hasn't seen that poll yet.
Well, here's the thing, though, guys. Here's the question. It has to do not so much with the poll, because they're two different things. The question is really, what's the primary reason a Democrat's going to vote, and what's the primary reason why a Republican's going to vote? I would be willing to bet you that more Democrats have cannabis legalization higher on their list of things than Republicans going to the polls. I could be wrong.
I don't think there's any doubt about that.
Right. So that's really.
I have no way of knowing, but I think you're absolutely right.
Yeah, I agree.
So that's two different things.
I think maybe in some age brackets, I think from 21 to 25, Republican, Democrat, all those, men at that age, probably most of them are in favor of legalization. I mean, because that's a pretty strong segment of use, the men between the ages of
the stigma is not there. I mean, it is changing so rapidly. You just don't see. People are so accepting of cannabis now. It's so different than even
in
5 years ago.
generation.
Every generation, even the old folks.
I don't know. I feel I don't know.
Well, we're the old folks. So.
I am the old folk, and I will say that in general, I will definitely agree that the stigma is changing. I have colleagues across the country, and I will say that my most conservative colleagues, the ones that are Christian, the ones that are more conservative, always put a little something up there. They can't quite go there when I put stuff on Facebook.
Is that right?
They can't quite go there. Yeah.
Can't quite go there. Yeah.
Yeah,
No, I get that.
yeah.
I see what you mean. Yeah.
Yeah. So, and, I have different colleagues of different, political parties.
Sure.
I know it was a couple years ago, but when they were collecting signatures, when the DC Cannabis Campaign was collecting signatures for the petition for the DC ballot initiatives, we had a lot of people who were federal workers. And you would go up and go, would you like to sign the petition? And they would go, I would love to, but I work for the government, man. And I don't want to be on the list, man.
Right.
Yeah, but they look at you, I guarantee you when I get in that voting booth, I'm going to vote in favor.
I'm
of
on
it.
your side. Yeah, that's true.
I'm not putting my name on that. Sorry.
Yeah.
So there is a stigma, and people are still worried about it.
And it's not because they're lazy. It's just because there's just...
I think you see it at
Job
dispensaries.
security.
People walk into dispensaries, especially older people, and they're kind of like, this feels like it should be illegal.
Yeah.
It really
I
does.
still feel like that.
I really
looking
kind of feel.
I mean, I think
I was
all
in a
of us.
dispensary.
Did
and
anybody see me come in?
Right. You kind of like put your head down. It's like you're going in to buy porn. Oh, dude.
I have to tell you.
Like going into the massage parlor. Did
I
anybody
have
see
to
me?
tell you, I had a good percentage I had some government workers who were patients when I worked at the dispensary, and
Right.
they'd sort of whisper it to me, and they weren't in any kind of position
Really?
where they had to have drug testing.
Right.
But they
That's the
certainly
key.
were not supposed to be there.
Right.
But they just were taking that risk.
If you work for the
So,
federal government, they're not.
Not for the federal government.
it's where we live,
Now,
Yeah.
working for the government of the state of Maryland, which technically I do, not a
can.
problem.
Not a problem.
That's right.
For the
Legal.
state, yeah, but not the federal government.
Yeah.
Until you just said that.
Yeah. Well, I mean, the federal government offices are right down the street from, around here everywhere. So, yeah.
Bill's going to work on Monday. Got Phil, the boss wants to see you in his office.
Or maybe I'm not. I don't know.
But there.
How long have you been working here, not counting tomorrow?
Speaking of that, now there is a stereotype that cannabis users are lazy, but there's a new study just came out. I have an article here that says cannabis users aren't lazy people after all. This new study says, but unfortunately, I never got around to reading the article. But
But
don't bump.
but apparently, according to the headlines,
Yeah. We'll eventually get to that
stoners
one.
aren't really
folks.
lazy, man.
I resemble that story.
Well. Now here's a story that I'm interested in, and Jay, you brought in this story, but I want to hear what Faye has to say about it. We got a synthetic cannabinoid drug for COVID-19. Did I read that right?
Yeah. This is out of Forbes magazine today. Emily Earlbaugh, she is a contributor there. She covers cannabis and so forth for Forbes. A new injectable drug aimed at coronavirus treatment has been approved to start FDA clinical trials. Stop and think about that for just a second.
Right.
Right? This is the FDA. That F
For
stands for federal. Okay.
and it's illegal.
Right.
Yeah. In
And they're
recent
using it as
months,
cannabis.
some have pointed to cannabis as a possible treatment for severe cases of COVID-19, pointing specifically towards a cannabinoid CBD. Of the cannabis' main chemical ingredients. Some researchers have suggested that this cannabinoid could be helpful. Now, a synthetic cannabinoid drug, ARDS-003, has been given approval by the FDA to begin phase one clinical trials. Now, I always find it interesting that the federal government, the FDA specifically, find it perfectly fine to test and even approve, in one case at least, synthetic cannabinoids. That's fine because it's not from the frickin' plant.
Right.
Faye, what do you think
Ridiculous.
about that, Faye?
It's
ridiculous.
the same. Show us the chemical compound.
It's
Faye.
identical, right?
I don't really have the chemical compound in
your
front of my head, but
Faye, stand up.
this is THC. This is
Oh,
THC.
that's THC. Okay.
Right, this is THC. But I mean, it's like I don't even understand why they would want to synthesize it. The only reason they would want to synthesize
The
it
only
is because cannabis is legal, and then they can also patent it and somehow or make money on it. I don't know is
I
there
think
a drug
you're onto
company?
something right there,
Is
Faye.
there a drug company involved in this? Who came
Yes,
up
there
with
is. There's
Absolutely.
a pharmaceutical company.
There you
It's
go.
called-
Bingo.
It's called Tetra Biopharma. They're a cannabinoid-focused pharmaceutical company, and they created this drug to help relieve acute respiratory distress syndrome. ARDS, which is a serious condition that occurs in severe COVID cases.
Among other things, yeah.
Among other things.
Yes.
One of the issues here, I believe, is that pharmaceutical companies, when they go to patent a drug, it has to be chemically consistent.
Right.
And when you're processing from a plant, especially a plant with like thousands of strains,
Yes.
it's impossible to get that consistent product.
Well, also, I think you're exactly right. But also, there's the fact when it comes to trademarking or however you want to put it, it's much harder to get that through with a plant than it is with a synthetic drug that you've essentially, or compound that you've created.
Right, like Andrew said, there's not only is there the synthetic compound, but there's all of these other, nutrients and phytochemicals and all of these things that I guess you can breed out in these other things.
And it's a whole plant medicine with different ratios. Some have higher, different terpenes and different CBDs and THC levels. It's a really complicated.
What is that Epidiolex for epilepsy? That's a synthetic. And it was approved with no problem, and they've got a patent on it. It costs $35,000. Right.
Well, think about this. And we talked about this earlier with like edibles and how it's taking a long time to be like CBD in foods, and how long it's taking for these patents or whatever to come, or like not even patents, approval. So you've got the FDA that deals with food, right?
Right.
But then there's also a drug in there. So you're dealing, and then there's
the D part of FDA.
And then there's also agriculture involved, because you're also dealing. It's just this way more complicated than just singling out a food or a drug.
It crosses all of the bureaucratic agencies.
Yeah, exactly. So. Yeah. Well, and not just that. It causes all the biochemical questions. The combination of them.
But at any rate, they're going to start, Jay. I believe it's a randomized, double-blind, controlled human study.
That's
placebo-controlled. Sometime before the end of the year.
Before the end of the year, December, and then they've got second trials and so forth. It could be 2 years before the drug's available on the market. But they say, well, even if there's a vaccine, some people may not be able to take the vaccine. There may be other reasons why this drug would still be effective, not only for coronavirus, but for other ailments related to respiratory issues, right, Faye, I assume?
Mm-hmm. Yeah, because it's, you're dealing with inflammation.
What about ailments of the cardio variety and cannabis? What can you tell us about that?
Funny you should ask. Excuse me. So back in January, this is a while back, and then COVID hit. So there were all these headlines about cardiovascular disease and how marijuana and cannabis can make it worse. And I had a lot of questions, so I wanted to go back to like the report. Mm-hmm. So this is coming from the Journal of the American College of Cardiology.
Okay.
And so it's like it's a review of the studies.
Okay.
So because the headlines were like, cannabis can give you a heart attack. Yeah. So I really wanted to get to the
right.
Yeah. So I really wanted to get to
gets your attention, right?
Yeah. Headlines are great. So we know that like more than 2 million Americans with cardiovascular disease have used cannabis. So like there's a high percentage of Americans with CVD, cardiovascular disease, that do use cannabis. But what do we know? Like, do we know if there are any interactions? And so there have been some associations with risks, certain risks. One thing is that they were talking about, the fact that the cannabis is becoming so much more potent. And that might have something to do with it. And so some data suggested that marijuana is becoming increasingly potent, and smoking can carry as many of the problems and health hazards as smoking tobacco, which I was surprised, because you always heard that. I was surprised about that. And so some of the associations that are listed are pretty intense. And so smoking-related cardiotoxicity, as I said, the same effects on your lungs and your cardiovascular system. Yeah. Coronary artery disease, apparently it can lead to smoking, can lead to increase, and cannabis, smoking specifically, but cannabis also, edibles as well, can lead to increases in heart rate and blood pressure. There is some indication that chronic use does build tolerance, so it doesn't happen as much.
Good, Andrew. You hear that, Andrew?
Yeah, that makes sense. And then,
Where get that going for
I know, exactly.
Which is nice.
But there have been studies that indicated usage of marijuana and heart attacks.
Really?
And really, what it is it's the closer to the heart attack, like within an hour, most of them have reported. So therefore, there is an increased risk of a heart attack if you're using cannabis.
Is that because of a heart rate increase?
It constricts the blood vessels.
Gotcha.
Yeah, it constricts the blood vessels.
Well, when I had my heart attack, it was in the morning, and I had not smoked that day.
Right. And I'm going to take this a step further and guess. Obviously, there's all types of other factors involved with this.
Sure.
And, predisposition, etc. But they're just seeing an association that they have seen that people have consumed cannabis. There have been an association prior to heart attacks.
Okay. What about cannabis affecting heart medication?
Well, that's the other thing, because they've seen irregular heartbeats and all kinds of things. So what they did find is that cannabinoids can interfere with antiarrhythmatics. Those are the ones that help your hearts beat regularly.
Yeah. Right.
Things like cortisone, pacerone, Tambicor, Covort, calcium channel blockers, which do help with blood pressure. Those are things like Norvasc, Cardizem, Procardia, Verapamil. Statins, which are the ones that lower your cholesterol. And a lot of people, here's the thing about statins. A lot of people are on statins that don't necessarily have heart disease. Me too. Me too. They're preventative against heart disease. Right. So what's
I take a statin.
Yeah, I mean, most people have heart disease too.
Most people our age probably do, yeah.
A lot of people our age, yeah. And then beta blockers, which are also for blood pressure, and warfarin, which is a blood thinner. So all of those have some kind of interaction with different cannabinoids. It could be THC, it could be CBD, it could be CBN, it could be CBG. So if
I did read one article. I'm sorry, but I did read an article where CBD in particular, where they're saying because people were taking these some of these CBD products have so much CBD in them. That it's having an effect on other medications.
Wow.
Well, THC as well. It's all of them. And so if anybody is listening who's a medical professional and you want more information, there is a chart within this article. Hey, hit us up and I can send it to you.
There'll be a link below, right?
Like which ones increase and which ones decrease. What each medication can do potentially with certain endocannabinoids.
We can link this article to the show description.
I know I can't because it's from the
journal.
The Journal of Cardiology. I had to contact a doctor friend who got me the link.
We can't link this article to the show description.
That's what
I meant to say.
That's why you have a health and wellness expert.
So with the bottom line, Faye, the bottom line is if you take heart medicine.
I think it's really important that, number one, you tell your doctor that you're on these heart medications. Chances are they're not going to know a whole lot about it. So you may even want to search for a physician who knows more about it. And there are physicians, at least around here, who are making it a point to learn more about it. Well,
your doctor probably knows you're on those medications. What you want to tell them is that you're smoking weed.
That's what I mean. That's what I meant to say. Yeah, exactly.
That you're using medical marijuana.
I'm sorry. Yeah, sorry about that.
I filled out a form today that specifically asked if I took medical marijuana.
I went to my oncologist. They asked me if I smoked. I said cannabis. I mean, but they didn't ask. The doctor didn't ask anything. So, see, we also need to train the doctors what to ask.
That's what I was going to ask you, Faye. That's what I found. I'm in an HMO, and I go, and my doctors know nothing about cannabis. Zero.
Exactly.
When's that going to change?
Well,
I mean, even in
think-
states where you have legal medical programs, like
Right.
your state, Maryland, they don't know shit about it.
Right. No, you're right. One of the things they recommended in this article, which I don't, is that they have a pharmacist involved in consulting if
Oopsie.
somebody is actually, yeah. But that would be something I'd be qualified to do after I
see.
take my
Your-
exam.
your-
I do
yeah,
think.
get your- yeah,
you
yeah.
know? I mean, after I take my thing.
You want to get that?
The bottom line is you open a dialogue, but it's really funny because the moral of the story is, within this whole thing, is, we need more research. No current guidelines exist because we need more research, but we can't do any more research because it's illegal.
Exactly.
Well, some states are doing research now, legal, but what the problem to me is not just that, because there is research out there. The problem is the doctors don't know shit. The doctors aren't taught. They don't know anything about cannabis.
Well, I imagine if you start with the cardiologist, they're probably forced to learn about it.
You think?
No, they're not forced to learn about anything.
Andrew can speak to this.
I asked my cardiologist.
No.
Did you? What did he say?
And what did he say?
She say?
And she said, and she's a wonderful doctor, one of my all-time favorite doctors I've ever had. And I've had a lot of doctors in my life. But she said, I said, listen, I'm an advocate for cannabis. That's what I do. And also I'm a patient, and I microdose, and I like vape, and I microdose like little one hitters.
Yeah,
You
sure.
know,
Right.
or sometimes they're in the shape of a blunt. But anyway,
Yeah.
cigar.
I don't smoke.
Sometimes these small blunts.
I'm a microdoser. Come on, man.
I don't smoke blunts. You guys know me. I don't smoke
Yeah.
blunts.
No, you don't.
No.
You don't.
But
Just kidding.
and then she said, as far as I understand, just you're okay. Just if you have a
Really?
problem, if you feel like something when you smoke and you feel something, let me know.
Interesting. So
But I think she was kind of like she didn't want to say one way or the other.
yeah, but she had a
And she's
conversation.
kind of honest. She goes, I really don't know.
Because I'll tell you, my doctor, I tested positive. I had to do a P test, and my doctor called me on the phone
for cannabis.
for drugs. They were looking for everything, and I tested positive for THC. And my doctor called me, and he flipped on me. You would think I was tested positive for heroin. I am not kidding you. He told me, he said, I cannot write you any prescriptions. I need you to come back in 6 weeks and test again. If you're positive,
Wow.
and I was like, what the fuck? Are you kidding me? Yeah, I smoke a little weed on the weekends, doc. He was
How old is your doctor?
younger than me. He's probably
Interesting.
significantly younger than us. He's probably in his early 40s. He
Because I
went
found
ballistic.
it sort of goes along age ranges.
I would
in
think
my
so,
docs.
Faye. That would make sense. But no, this guy was ballistic. I mean, it was
Wow.
like, whoa.
Maybe he was a military doc before he became a doc.
He wasn't actually, but I tell you, and I've run into
I don't
that
have
more than
patience for
once.
doctors like that.
What about you,
Yeah.
Andrew? Have you,
You know
had
what?
an
I think it
experience like that?
scares them. I think it scares them because they don't know what to do with it. They don't know any information, and so they're like, they don't know how to advise you.
It wasn't like he just said, you know what, dude, we have a policy here at the HMO where you can't do this, or I can't write. No, he was like, it was a personal thing.
Wow. See, my doctor, I asked him directly about it before I got my cannabis card. I wanted to see if he knew of any medical reason why I should not
Personally, yeah.
personally smoke weed based on his knowledge of my medical. He said, "You know what? I'm the wrong guy to ask. You don't want to know what I think." Just
Wow, really? Okay.
And so he's against it, but he didn't make a big freaking deal about it. He's just I'm not the guy.
How old
you
is he,
wanna ask.
Phil?
Probably a little young. He's probably in his 50s.
Faye, what's your thoughts on the medical profession as a whole, in general, attitudes towards cannabis? They still think it's like a recreational drug. They don't look at it as a medicine.
I really find it depends. It really does, because I have my doctors all here in the DC area, and the oncologist is out of Hopkins, and he really didn't want to talk about it. Mm-hmm. My personal physician, she's like, my doctors tend to say to me, you kind of know what you're doing, because they know that I'm going along for this, I'm
Right.
learning about it, and I'm learning the biochemistry,
Getting a master's
I don't know enough
degree,
about
yeah.
Usually they just say, I don't know enough about it.
That's
And
what- that's what I hear a lot.
Usually what they say. So I see a future for in services for doctors. They should have this training.
Well, I asked my general practitioner, and he said, I need to know the LD50.
Right. I heard that too, Andrew.
I need to know, I'm not going to prescribe. I don't know how to prescribe it. You know, if it works for you, great, man.
Well, you know the answer to that, though, Andrew, right?
It's zero. Right. Yeah, that's right. There isn't one.
Well, it's zero. I said, they've been trying to kill animals for years with weed, and they can't do it.
The LD50,
they can beat them to death with a bag, but that doesn't,
I think the LD50 is 15 pounds over 2 hours or something ridiculous like that.
It's 1,500 pounds in 15 minutes or something.
Yeah, something
explain what that is, Andrew. Andrew, explain what the 50-50 is.
Well, LA50 is what the dose that kills 50% of the people when they take it.
Right.
Well, I think the thing that you have to remember with doctors and medical school, and they have a certain training, is they just want to know about doses, and we can't tell them that yet.
Right.
All right. Well,
the last time I went into my doctor, I told him that he needed to get certified and start, writing prescriptions for people. Because I said, God, it's $200 a pop. You got to come back once a year, man. What the hell, man? Come on,
That's right.
And the reason I said that is because my doctor, he sees people who can't afford it all the time.
He
does free. Matter of fact, he'll even pay co-pays for some of his patients.
Awesome,
He's really cool.
That's nice.
Anyway, Faye, we sure did enjoy having you on, and before we went,
having me.
We always enjoy your health and wellness insights.
Thank you.
And
I enjoy being here.
And you're just a fun addition to our little cadre here.
Thank you. Now, how do you say that?
I think a lot of our listeners are going to learn a lot from Faye in the years to come.
I know I am.
Absolutely.
Well, I always feel like I don't know enough, but that's because there's not enough to know out there, but soon I'll be telling you more.
And here's the thing. If you want to know more, after you've gone on to Apple Podcasts and given us a 5-star rating, if you are so inclined to do so, we hope you are, get in touch with us and ask Faye anything you want about, and if she doesn't know the answer, she can tell you where to find it probably.
Or look it up.
Or look it up.
Or ask my advisor at Maryland.
If only there was some network of computers that we could
I wish we could figure that out. Send us an email.
A device, yeah.
podcast@VoteProPot.com. That's how you can do it. And go on. We're now video, as you know. So go on YouTube and do a search, one word, VoteProPot. You'll find our page. Subscribe, like us, watch our videos, and all that good stuff. And go to our website, VoteProPot.com, and check out our mugs.
Wow.
Yes.
Help the cause.
They're pretty cool.
I got an email this week, guys. I got a couple. I've had a few now. People say, they like watching the video. Our video, nobody's watching it. We got like 50 watchers,
We've only been doing it a couple weeks.
I hope they're not looking at me.
We got thousands of downloads on our podcast, but nobody's watching our. So a couple people have written us and said, what's up with Andrew? I can never see his face. So I told him you're in the, witness protection program and he's laying low, and so you have to be careful.
Just whenever, because the thing about Jay, Phil, and I, we're musicians. We've been playing music together since high school. Actually, Phil and I were in a band at junior high school.
That's right. Yeah.
And before we even started a band with Jay. And anyway, so we're just used to micro, and this is how I've always thought. My
you're used to being right
on top of it.
That's right.
But I think this way, because I'm listening to it, and this is how I can control the sound of my voice, not like it. And again, I have the face for radio. So. But speaking of that, we're coming on that time of year that we need everybody to get off their asses and get out and vote. So if you're not registered, get out and register. Now you can go to Register. Reggie. Anyway, you can go to VoteProPot. You can go to VoteProPot or go to Rock the Vote, and you can, from the comfort of your own home, you can register to vote.
You don't even have to get up.
And then once you're registered, you can sit away for an absentee ballot. And you can, so the whole process of registering to vote, getting your ballot, filling out your ballot, putting the stamp back on it, and putting it back in the mail, you can do that whole process with a joint hanging out of your mouth.
Right.
From your couch.
Yeah.
And so please get out, and also ask everyone if they aren't registered, go over and help them get registered. And on election day, go out and pick them up. Do a carpool to the polling sites.
Wear your mask.
And we're not telling you who to vote for.
Cast your ballot.
Right. Just vote pro-pot. That's all we're asking.
Vote
and also,
pro-pot.
if you're interested in getting more information, we can't even scratch the surface of all the stuff going on in the marijuana world on our podcast every week. So we share a lot on social networking. So please, if you have any comments, please join us on social networking, add to it, comment, share any information you have, or just read what we share with you. So just go to LinkedIn, Facebook, Twitter, and Instagram and do a search for Vote Pro Pot.